We absolutely need it, right? I would always talk, again, I'm trying to be careful what I should say, what I shouldn't say, and then I just go back to what I'm going to say, which is fully transparent. We have an access problem, right? We can't scope everybody, whether it's a colonoscopy and an endoscopy, we can't get to everybody. And we have a cost problem, right? So non-invasive tests are only strategy to get that next barrier, right? Get past that next frontier. And non-invasives, if done correctly, will help us truly triage who needs that next endoscopic evaluation. Even in best estimates, we don't need to get into details, but you look at the colon cancer screening space or esophageal cancer screening space, best estimates, 60% of who needs to be screened are being screened. You know why? There's only so many of us. There's only so many places you can go get a colonoscopy. So you need non-invasive to help triage those people who are the 40% that we're not catching. Which of those 40% need a colonoscopy? Absolutely need one. They needed one yesterday. They needed one 3 months ago. Those are people we can't miss. Colon cancer can be 100% prevented if you find a polyp. Okay? So if you're in Connecticut, where I am, or you're in the West Coast, you're in parts of the country, in parts of the Midwest where you have access to gastroenterologists, you can have this conversation. You talk to your GI and say, hey, what should I do? And what I tell them is, hey, you're in a part of the country where you have options. If you want to prevent cancer, there's only one way to prevent colon cancer. You got to find and remove a polyp. Okay? Done. That's a colonoscopy. If you want to just detect, if you want to just know yes or no, do you have colon cancer? You have multiple options. Now, say you are living in a place where you don't have a gastroenterologist nearby, and you're having this conversation with your primary care provider, and they say, okay, all right, we can get you in to see GI to have this conversation. It will take 6 to 12 months, but we'll get you there. That person should be on the conversation. Or we can just find out right now, what is your risk? What's your triage risk? Let's detect if you have cancer, yes or no. You're non-invasive. Most of us will argue, unfortunately, if we detect cancer on a non-invasive, we already missed the boat, right? We already are a little late, but it's better to be there than to wait 1 more year or 2 more years when that patient is being found in the ER with rectal bleeding and now it's spread everywhere.